Thank you. Dave Thomas. I live in Ridgeway, and I've been here since, I guess, about 1960. Started working on the railroad and then ended up being retired. And I have good health, fortunately, and I'm doing all right, enjoying the things I want to do. And one of the reasons I can do it is because we have public health care. So it's so important to keep that health care up and keep it going. I have a nephew that graduated from nursing school right at the time that 10,000 nurses were being laid off, back around 1995 or 96. So a U.S. hospital is now making good use of his skills, as well as his wife. They were both nurses, and they're working in North Carolina right now. My wife has had a couple of surgeries in recent years, and has thankfully done well with it. She lives in Hamilton. Of course, I live here. The idea is we keep our junk out of each other's way. We had no problems with timing of the surgery. She got everything done in due time and so forth. But like anything else like that, she was discharged in very short order. So I was down in Hamilton helping her. Of course, within a day or two of being discharged, little complications come up and I had to go to emergency. Well, we've heard a number of stories about the long waits in emergency. I think when we had emergency room in Fort Erie, I don't think I ever waited more than an hour, no matter how many ambulances came in. But it's common in Hamilton and the big cities to have a wait of at least 4 hours. Now, if you're uncomfortable, you're sitting there in your nightgown and your house coat about 5 or 6 days after surgery, and you've got a problem, you've got to wait 5.5 hours to be seen. There is a problem. And when that goes on systematically for year after year after year, but remember, it's not that long ago that we had the ambulances running from one hospital to the other to try and get emergency cases in. But the thing is, we have to keep our health care public, and we have to make sure that nothing gets privatized, because it is not going to lower the cost, it's going to increase it. I also have stories about, if anybody thinks the American system is better. My wife's brother died, he had a brain tumor and he had surgeries in Florida and in Houston. So he lasted about 2 years after his first surgery, and $500,000 later, he ends up the same as he would have. But the choices down there were not as great as we got here, even with the problems with our system we have now. So keep at it, keep it going, and thank you very much.